Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. The current 5-day COVID-19 test positivity rate is 2.9%. 49 new cases of the virus have been identified, with 25 cases being identified today as of 9:30 a.m. and 24 cases that were connected to Sunday, August 23rd. This brings the total number of lab-confirmed cases in Manitoba to 993. There was a data correction made to Sunday's numbers, and this makes today's case count 25 and Sunday's case count 96. Of those 24 from Sunday, the remaining 24 from Sunday that we're reporting today, the majority are linked to our intentional testing campaign in communal living communities. There were 3 single cases from Southern Health, Interlake Eastern, and Winnipeg region. Of the 49 cases in total, 35 new cases in Prairie Mountain Health region, 2 new cases in Interlake Eastern, 4 new cases in Southern Health, and 8 cases in the Winnipeg region. We have 6 current hospitalizations with 1 individual in intensive care. 395 active cases and 586 individuals have recovered, and the number of deaths due to COVID-19 remains at 12. Testing numbers yesterday, 1,544, and taking our total to 127,149. Preliminary investigations indicate that a majority of today's Prairie Mountain Health regional cases are linked to testing related to known clusters in communal living communities. This is an indication that public health in those communities are being proactive, self-isolating, and following public health advice. Communities are cooperating and want to get their communities and their region back on track. None of today's cases are linked to the outbreak at Bethesda Place Personal Care Home. We have some of our cluster update. For Prairie Mountain Health, there was 320 total cases since July 1, with 196 active cases. Related to the business in Brandon, we have 52 total cases that are linked there, with 34 being active. We have 20 total cases of those that are linked to that broader PMH cluster. As far as communal living clusters, there have been 236 total cases with 148 active. And the Bethesda Place outbreak remains at 7 cases. So starting today, Prairie Mountain Health region is elevated to the restricted level orange, according to our pandemic response system. Masks are mandated in indoor public places and outdoor public gatherings of a size greater than 4. Masks are not required if people are able to be seated and at least 2 meters from others, or there is a non-permeable physical barrier, including a plexiglass barrier. The mask must be worn at all times while moving to and from their seated position when in that indoor public place. Employees, contractors, and operators of an indoor public place do not need to wear a mask when they're in an area where members of the public do not normally have access, or if they too are behind a non-permeable barrier, including a plexiglass barrier. Other exemptions include a child under 5 years of age, a person with a medical condition that is unrelated to COVID-19, including breathing or cognitive difficulties or a disability that prevents them from safely wearing a mask. A person who is unable to put on or remove a mask without the assistance of others. People can temporarily remove their masks while in an indoor public place to receive a service that requires the removal of their mask, actively engage in athletic or fitness activity, including water-based activities, while consuming food or drink, dealing with an emergency or medical purpose, or to establish their identity. A person who enters or remains in an indoor public place must wear a mask in a manner that covers their mouth, nose, and chin without any gaping. For a list of indoor public places and additional details to the public health orders, visit manitoba.ca/COVID-19 on the state of emergency page. Public gatherings are limited to 10 people, and that's both indoors and outdoors. This includes weddings, funerals, banquets, receptions, and professional sporting activities. More than 10 members of the public may attend a business or facility that is allowed to open under these orders if physical distancing measures are in place, and people maintain that distance of at least 2 meters. The outdoor public gathering applies to 4 or more people, and a mask must be worn in the appropriate manner. So again, these measures were first articulated on Thursday. We're providing details, further details today on these. And again, our enforcement of these are going to stay the course with our typical enforcement of public health orders. We're going to start with education and support for individuals, and enforcement would follow if necessary. We are advising of a potential exposure to COVID-19 may have occurred at the Safeway Corral Center, 921 18th Street North, Brandon, on August 15th from 2 to 6 p.m., August 18th, 11:30 a.m. to 8 p.m., and August 19th, 2 p.m. to 4:45 p.m. Public health is considering this the risk of transmission to be low. But those who may have been exposed should monitor closely for symptoms, self-isolate should they develop, and attend for testing. This is another reminder to ensure we are staying home when we're ill as soon as symptoms develop, even if they're mild. You can see our daily testing numbers have been averaging quite high. So we're again encouraging symptomatic Manitobans attend for testing, or Manitobans who have been advised to go for testing from health care professionals. We're suggesting against asymptomatic individuals attend for testing, and again discouraging employers from sending asymptomatic employees for testing. We know with these increased numbers, we have those concrete steps that we've all been accustomed to adhering to. Staying home if you're ill, even mildly ill, good hand hygiene, physical distancing when not in your household, and now wearing a mask in indoor public places, which is now mandated in the Prairie Mountain Health region. We again advise against stigma. We know that plays a negative role in our ability to garner cooperation with public health and public health policies, and so really just be kind, avoid stigma, and public health will continue to be able to cooperate with many communities who are dealing with cases at this point. So again, visit our website, manitoba.ca/COVID-19 for up-to-date information, and can open that up to questions.
Thank you, Doctor. We go to the phone first today from CJOB, Diana.
Good afternoon, Dr. Roussin, Diana from 680 CJOB. I know you obviously gave the positive test rate for the province, and you kind of break down community transmission for the province as well, but what is the positive test rate for each regional health authority, and also the community transmission rate for each region?
Yeah, so the positive test rate is a difficult one, so I'm not sure when we'll be able to reliably report on that region by region. There's some difficulties with being sure about the denominator on those things, so I don't have those numbers. The community-based transmission numbers overall in the last 7 days, we have a 39, and that's province-wide, and we know that metric is about 19 to 20% of new cases are falling into the non-epi-linked, that community-based transmission at this point. Although a number of the recent cases that we've had, we have been able to link with clusters, but the overall trend right now is about 19 to 20%, and 39 in the last 7 days are not linked.
Okay, thank you. And then as a follow-up, you mentioned communal living situations over the weekend and again today. Obviously, quite a few in the Prairie Mountain region. Are there any in the Southern Health region currently where there's active cases in the Interlake? What does that breakdown look like?
Yeah, I don't have the breakdown by region, but yes, there are the similar clusters in Southern Health and in Interlake Eastern. As we saw, especially over the weekend, such a large proportion of the new cases were a part of a planned testing strategy. We felt it was imperative to communicate that to Manitobans to get a good sense of the actual numbers we're getting in communities. That we see a great proportion on very tight clusters.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Question. So I think you just said around 19 to 20% community-based transmission, in the last week. How many weeks in a row do you need to see that before? That's almost double what it has been throughout the pandemic. How much longer do you need to see that before, some sort of restrictions are in place?
Well, I mean, we have put restrictions in place in areas that we've seen it increasing, right? Prairie Mountain Health, and that was part of the reason for implementing those restrictions. And again, it's not just the only number that we follow. We're not seeing a significant strain on our healthcare system right now. If we look at that trend, which we follow closely over the last couple days, high numbers, but the vast majority of these high numbers in the last couple days, we are linking to clusters or to previous cases. So we keep following it. It's one important indicator that we follow, but not the only.
Sure, and you've talked before about a lag in terms of when a case is positive, somebody becomes positive, and the time that they would need hospitalization. Are you expecting hospitalizations to rise given how many cases we've seen over the last little while here?
Well, I mean, the issue is the more cases you have, then the more likelihood you're going to get severe cases within there. And so certainly with our active cases right now and our hospitalizations, it's much lower than what we've seen in that first few months that we were dealing with this. Possible explanations is that we're seeing transmission amongst younger people right now, who we know have always had less risk of severe outcomes with this. And then the other is that it sure could be a bit of a lag here, although it's been some time since we've seen these increased numbers. So it's difficult to predict, but what we know right now is we're not seeing that significant strain on the healthcare system.
From CBC Radio Canada, Julian.
Good afternoon, Mr. Roussin. The test positivity rate is close to 3% now. Are you planning to increase the safety measures throughout the province?
Yeah, I'm sorry. The just mentioning the total number of cases we have and whether we're going to increase the restrictions throughout the province. Is that the question?
Yes, this is the question.
Yeah. So, I mean, it's our pandemic response system is there to look at these indicators. The total cases is one such indicator. It's not the only indicator we look at. And then again, a lot of those total cases are in clusters, are linked. And so we do have that ability to increase restrictions. We did so in the Prairie Mountain Health region where we saw the significant concerns at this point. But any region could be looking at increased restrictions should the situation warrant.
And as a follow-up, the workers on Maple Leaf and Brandon asked to enforce safety measures in the facility. So will you address their claim to shut down the facility and increase the safety measures there?
So there are a lot of safety measures that have been in place for quite some time, and we're working with a lot of agencies, Manitoba Agriculture, Public Health, as well as CFIA, along with the employer, who's quite cooperative with this. So the protocols in place are above and beyond what we would normally see. And as we see, a number of cases that happen to work at that place, but we see the active case numbers have been declining over time, as we would expect. So we're watching it really closely. We still don't have evidence of interfacility spread, and so right now there hasn't been any agency involved that's suggesting we shut down that plant. But we'll continue to look at the situation.
From the Canadian Press, Steve.
Dr. Roussin, just looking at the stats today in the Prairie Mountain Health Region, and specifically in the Brandon District, it looks like in terms of active cases, less than a third of the currently active cases in the Brandon District are connected to the business, the plant. So can you explain what's going on in Brandon? Is there another cluster that has widespread community transmission? Is there some other sort of cluster that we're not aware of?
Well, so the original cluster in Brandon is not directly related to any business. It just happens to be a number of people in that cluster worked at that business. So this cluster did not start at the business. The cluster is just in a group of individuals that happen to work at that business. So at first there was that large cluster, which was related at a community level in a geographic region. Since then, we've seen a number of different clusters develop, which not necessarily connected to that original cluster. And then on top of that, we see some community transmission. So that was why we're leading to increased restrictions in the area.
And when you, on occasion, you've used the term communal living communities. When you use that term, and I know you don't want to identify anybody specifically, are you referring only to geographic communities, or can they be demographic communities within a city? Because again, I'm referring to these large numbers in Brandon District, which is the municipality, and not other areas of the Prairie Mountain Health Region.
So when we refer to the communal living communities, we're referring to sort of tight geographic regions, and that's not what I'm referring to when we're talking about that Brandon cluster.
From CTV Winnipeg, Danton.
Dr. Brent Roussin, just following up on that, can you tell us how much testing is being done on colonies or on these communal living areas?
There is a substantial amount of testing that's being done, on and off of these communities. I don't have an exact number, but there's been especially from the results over the weekend, we're actually mobile testing, where we actually went to communities to perform testing. So we got a high amount of testing done, and then a significant amount of cases were identified by that. So there's testing being done through the usual process, but then there's also some mobile testing that's getting out and getting testing bring out to the communities.
Okay, thank you. And then also, you mentioned a little bit about this before, but what kind of enforcement will be happening in Brandon and the Prairie Mountain Health Region with these restrictions?
Yeah, and I think the key right now is that we've just recently elevated the risk level. This is the first time that we've really implemented this pandemic response system like this. We were just able today to provide some of those details to individuals and to businesses. So certainly at first here, our focus is going to be on education and trying to get people on board with this. But the enforcement, if necessary, can take the manner of how we enforced other aspects of the public health orders. Tickets could be levied. But again, for the most part, our most success that we get is to educate people and try to get people in compliance.
From City News, Jonas.
Good afternoon, Dr. Roussin. Just want to kind of touch on some of the active cases in the different regions. So for Prairie Mountain, when it comes to the active cases, so how many are linked to clusters and how many are in the community, just for folks there to get kind of a clarification on what's happening?
Yeah, and so I think I just have sort of the overall active numbers right in front of me that I mentioned earlier with the clusters. So I mentioned it earlier. So that doesn't apply to just one region. It was all of the regions there. So not sure if I have that. The number that I mentioned. There was 236 total cases that were related to communal living communities, with 148 active cases. So that doesn't just include the Prairie Mountain Health region, though. That's all regions combined.
Thank you, sir. No follow-up. Thank you.
From the Brandon Sun, Colin. From the Brandon Sun, Colin.
Sorry about that. Dr. Roussin, in the open letter sent out by Maple Leaf workers this morning, they specifically say that they believe that transmission is happening at the workplace because there are people getting sick who haven't been in contact with possible cases outside of work. What would you say to sort of alleviate their concerns about that, given that despite your saying that there isn't workplace transmission, people continue to be worried?
Yeah, and so I can't speak specifically on that letter, but I can speak with on the information you provided. So we've Public Health, along with a number of agencies, have been looking very closely at that facility, because we know that in other jurisdictions there's been transmission events that took place. So we've been spending a lot of time looking at the situation, trying to find evidence of workplace transmission. For the most part, if we saw small levels of workplace transmission that we haven't seen yet, we would implement the measures that have already been implemented. Our first step wouldn't necessarily be to shut down an entire facility. So there's a lot of PPE. There's a lot of distancing, there's a lot of barriers, a lot of monitoring, there's cohorting, and we're following things really closely. We'll continue to do so. But just that right now, there's many agencies involved, and as the way things look right now, none of us have recommended that we should shut down that facility.
My follow-up question is on a slightly different note. With Code Orange being implemented starting today, how soon should we expect to see any change in the daily number of cases in Prairie Mountain Health, if at all?
So to see that change, if it's as a result of these orders, then you're looking at that 10 to 14 day minimum. So everyone who's going to develop COVID in the next, say, 10 days or so have been exposed prior to the onset of these restrictions. So after that, we'll be able to get a sense on whether there's less transmission going on.
From CKDM, Matt.
Hello, Dr. Roussin. I'm just looking for some clarity on the maximum gathering sizes of 10 people for the Prairie Mountain Health region. So for something like a golf tournament in the Prairie Mountain Health region with a gathering of 100-plus people, is a large gathering at this kind of situation allowed because they already have their own set of public health guidelines they've been following?
Exactly. So the group sizes have always been part of our order, and they've changed over time. And so this order is only changing that group sizes. It's not changing other aspects of the orders that are in place. So, for instance, a restaurant isn't set at a maximum of 10 people. The restaurant has to follow their typical, their orders that are in place right now, which requires that 2-meter separation between tables. Recreational facilities, sporting events like golf have their own set of orders. So this 10 does not apply to that. It only applies to public gatherings and events such as weddings, funerals, banquets that we mentioned. So all others that have their orders in place, they'll continue to follow their typical orders. Faith-based gathering, religious services are restricted to 30% capacity with that cap of 500. That doesn't change. And so if there's an order in place for that sector, they follow the current one.
No follow-up. Thank you.
From the Verdun Empire Advance, Anne.
Yes, hi, Dr. Roussin. Am I to then understand, following that answer that you just gave, that things like church services would stay at the 30% gathering?
That's correct. Yeah, and so the reasoning is that the other sectors that have orders in place, they've been in orders in place for some time. They have protocols in place to limit the risk. Plus, what we see from the epidemiology was that the transmission is in the Prairie Mountain Health region is occurring in these public gatherings and events that are outside of these other sectors. So, like our approach for this pandemic response system, we wanted to be as targeted as we could. So we didn't target a sector that right now we're not seeing significant transmission in. We focused on where we're seeing it.
I see. My last question then would be, is this going to be for 2 weeks? Have we got a time frame for this orange restriction?
Yeah, and so it's a good question, and the answer is it has to be at least one incubation period, which is the 2 weeks, and so but very likely longer because at that 2 week period we're just going to start being able to get a sense of the effect of it. And so we're going to want to have a sense that the numbers are continuing to trend downward before we loosen the restrictions. So there's no set time, but I can't think of a way that it would be on for less than one incubation period, but much likely it's going to be longer than that.
From CHVN, Taylor.
Hi, Doctor. A question also along the religious services gathering sizes. For people who are gathering, will they be required to wear masks when they are sitting in service?
Right, and so the indoor public places is sort of the default. So anywhere with the indoor public place, where masks are going to be required. However, in places where you're seated and managing the distancing, then it won't be required. So in religious services that have that in place, where people are seated, there's physical distancing between families, then you won't necessarily have to wear a mask in that circumstance.
And what is the province's stance on choirs still?
Oh, sorry, I didn't catch that.
For choirs, is the province currently recommending or not recommending them to continue for religious services?
Oh, yeah, I still. Oh, choir. Right now the transmission, we know it's droplet spread. There's been some reports of transmission with people singing in large groups. So we don't have an order prohibiting it. But we say, with caution, ensure there's distancing. If it's, right now where we're seeing increased transmission, if things that might have a little bit increased risk can be avoided, and that would be great. So on our website, we do have all of the guidance in that regard.
We now go to room 68 for reporters. Go ahead.
Dr. Roussin, do you have an update on how many people employed at Maple Leaf and Brandon have tested positive so far?
And so the number I have in the total cases of people who are employed there, I have 52. There was what we reported there, and so and so some of that is they might have been counting people who are linked. So if you're an employee there and then a household member was positive, we'll count that. So we'll make sure about that. But we do have 34 active cases.
Dr. Roussin, can you clarify the communal living numbers you just mentioned? 236 cases attributed to communal living situations. Is that, what time period are you talking about?
That's in the total of our case numbers, yes.
And 148 active
that
cases.
Are active, yes.
Can you then clarify yesterday's numbers? 47 yesterday were attributed to colonies, now with 96. What are we looking at yesterday and today?
Yeah, so we had the additional 24 yesterday that we didn't report yesterday.
Were those all communal living?
21 of them. 21 of them.
And what about today?
And then the rest, many of today are, and so I believe at last count we had 31 of the 49, of the total 49 were linked, but some investigation still going on.
Dr. Roussin, in our last week, most recently available weekly report, 7 new healthcare workers infected. You also have today an issue that people must wear masks at healthcare facilities. What's going on, and how concerned are you that the virus has now moved back into the healthcare system, and what are we seeing with the healthcare system?
Yeah, so we're not seeing, a lot of transmission within the healthcare system. We're seeing, healthcare, people who work in healthcare with it. We do at Bethesda had the 4 staff, and so certainly when we're looking at a personal care home, anytime we see the virus there at all is concerning to us. So we've put a lot of measures in place there, did a lot of testing with it. But yeah, we're going to continue to watch those numbers, and I think with, we've learned a lot over time with this virus, and as we move into respiratory virus season with things like using masks in those facilities, we're hopefully not going to see the numbers that we saw earlier.
And along that line, do we know where the Bethesda outbreak started now?
We don't have necessarily a conclusive. There was a staff a member that tested positive that had worked during the infectious period, but not during the a period of symptomatic spread. And that's the only possible link we could look at now. It was at the stretching the incubation period a bit, but that's the only thing we came up with. And even after that was identified, there's a lot of measures put in place, and then a lot of widespread testing.
Was Bethesda abiding by the 1 worker, 1 facility practice?
From what I know, yes. Yeah, I haven't heard anything to the contrary.
Dr. Roussin, there have been people calling for the compulsory wearing of masks in transit buses. Mm-hmm. Where do you stand on that? Do you think it will come to that?
Yeah, I think for some time it's been a strong recommendation to wear masks when physical distancing can't be obtained. And then the messaging has really continued to evolve to really just in indoor public places where you can't even be sure. So certainly my recommendation is on public transport to wear a mask.
You see, like in September when some university students will probably attend some classes, although a lot will be remote, and more people perhaps going to work on using transit buses. Do you see maybe more than a strong recommendation?
So we certainly have done that in Prairie Mountain Health. So that's part of the order. So it's required there. In Brandon, yeah. And so over time, so none of these things have ever been off the table. And so if you see the trend that we're successful the first few months with this virus with very stringent public health restrictions. And so, the only public health measure between those restrictions is masks. And so that's where we may go before we get to any further, widespread restrictions.
Dr. Roussin, sorry, just going to step in here. We're nearing, at the beginning of the pandemic, we were talking about a percentage rate across the board at certain rates. So we were at 1 point something, we were at 2, now we're at 2.9, we're almost nearing 3% for that 5-day rate. At what point do you feel like restrictions are going to come back province-wide?
Yeah, and so again, we look at a number of indicators, and when we look at the positive test rate, which is often a very good indicator, it's a bit skewed when a huge part of that positive test proportion is related to tight clusters. So if you look in the last few days, the 2/3 of that positive test proportion is related to just cluster outbreaks. So it's a bit misleading, that number, when it's this high. So we're looking at things like the community-based transmission, and also have to keep in mind, one of the biggest goals when dealing with the pandemic is to reduce severe morbidity and mortality, severe disease and outcomes. And right now we're not seeing a huge strain on our healthcare system.
Perfect. And so when we were talking about that, my colleague Diana asked about the positive test rate by region.
Mm-hmm.
Would we be able to get some more answers? I know you said you didn't have the numbers right now, but would we be able to get those numbers for Brandon, Winnipeg, Prairie Mountain, just because we're saying it is cluster-based and then it's not province-wide, the test positivity rate?
Yeah, well, we are working on that and trying to get numbers that will be reliable and that we can report regularly, but I don't have an update on when we can get that.
Doctor, also in the weekly report, we're seeing a trend towards more close contact transmission and less travel transmission. What does that tell you? What should we glean from that?
Well, I just think that as we get a number of more cases, active cases in the province, we know that roughly 14% of contacts become cases. And so the more cases you have that are right here, then a greater proportion of the cases will be contacts of those people. So it's, travel from many jurisdictions still poses a risk to us, but we have, our own transmission chains right here in the province.
Are the mobile teams still at the communal living communities? I know you don't want to identify them as colonies. Are they still there? And if they are, how many more days will this targeted testing go on?
Yeah, I don't know if there's any that are still doing this right now. There's probably plans in the works to go where needed. And so this testing reporting on took place late last week. And then we get that, the turnaround time to be able to report it. So right now I'm not aware of any that are actively going on, but it certainly worked quite well in this instance. And so we'll probably likely see more, which means we'll see more cases, but they will be linked.
Dr. Roussin, if there are 3 or 4 people living in a 2-bedroom apartment, 1 bathroom, and someone tests positive in that home, it's very likely that will everybody get COVID, and what would your advice be to folks living together in a small space like that?
Yeah, and so I mean our secondary attack rate overall is 14%. It's probably a little bit higher in situations like that, but this is the very purpose for alternate isolation accommodations.
And when can people use those accommodations?
So any contact or a case that's been advised to self-isolate, if they don't feel that they can do it in what they have now, we can set that up.
When we're talking about the community-based, like communal communities, when we were talking about that, now that you're doing more testing, now that we understand that they're based, do you expect the numbers to still go up at this point?
Yes.
Before they come back down?
Yes. Yep. And so I think we're as we're reaching out, working with the communities. Communities are cooperative and have a lot of interest in this. Then we're going to see cases that are related to that. And again, so it's to take that focus away on just the total number of cases we report, because it can be misleading.
Forgive the broken record here. How close are we in at least Prairie Mountain or maybe Brandon from saying schools should be delayed?
Yeah, and so we're working with education. I don't think I have a, again, we look at so many different indicators. Certainly orange is that trigger to start thinking about some of the different levels that were laid out in the education plan, although we're not there right now. But we're working close with them, and we'll try to keep Manitobans posted. And I think that Manitobans have come to learn that you have to be very nimble and responsive to this virus. Things change really quick.
But am I correct in the assumption or the suggestion that it's easier to put off school a couple of weeks at the beginning than it is to put people there and take them out, especially from a contact tracing perspective?
Yeah, so I'm not really aware of any plans to delay opening like that. So I think we're looking at what public health measures in each region are necessary. But like I say, things have changed so quick with this. I would say that we weren't really expecting to see the numbers we did this soon. I think we were thinking that in fall we would see numbers maybe even eclipsing this. And so we just have to keep focused and do what's best for the kids. So, but working with education, but I'm not aware right now of plans to delay. But nothing's ever been off the table.
With schools opening soon, do you have sufficient resources in contact tracing?
Yeah, and so right now we're still getting to a number of cases, quite a high percentage of cases within that 24-hour, or contacts within that 24-hour period. Certainly when we had, 96 cases on Sunday, then that average is hit a bit with something like that. But right now, our capacity is there. Certainly, public health capacity has been, stretched with these numbers, but are meeting the targets we want. And then, in addition to that, we're able to open our contact center, which takes a lot of the load off regions with the active daily monitoring. And then you're aware of the RFP that we have in place. Should our capacity ever be really challenged, we would have a resource.
Last one here, guys.
Do you have a prospective plan in place in the event of a snap federal election for pandemic procedures regarding campaigning, voting, everything involved?
Yeah, that's not something that I have, a detailed plan on for right now. I think that, for most of these, our responses to this, it's the fundamentals are the same. So if we are in that type of spot, I think this is going to be really multi-agency working together to try to do that as best as we could.
Thank you.
Okay.
Thanks for all that, as usual.
Yeah, thank you.
Thanks.